The way that Leukaemia Busters came about was as a direct consequence of our own son's development of T-cell leukemia, a particularly aggressive form of leukemia, of which only approximately 50% of patients were cured of. It was, for both of us, it was a great trauma. My wife and I have worked together for almost 40 years, believe it or not. And during that time, we've developed a very close working relationship, an understanding of the scientific endeavours we undertake. So it came as an enormous shock to both of us when Simon was diagnosed with the very disease which we were actually making antibodies against at the time. It was one of life's great ironies. The initial effect it had on both of us was, as it is for most parents, was of enormous shock and horror. It was a time that is difficult to describe in words, but it became like a surreal landscape to us. But once we'd accepted what had happened, it gave us that greater determination to move forward and do something positive for patients with leukemia like Simon. Of course, initially we believed fervently that he was going to survive the disease and that chemotherapy would cure him, but sadly it didn't. And that really had a really adverse impact on my wife, who at the time said, I can't possibly go on working with the disease that killed our son. But actually it was Simon himself who changed that just before he died, because he told my wife, B, that she mustn't give in. On his deathbed almost, he was telling her, imploring her not to do so. And that, of course, changed the whole scenario for her. She's now 101% committed to carrying through the work we started all those years ago. When other parents met my wife and I, they realized that we were working in an area, making antibodies, to diagnose leukemias and lymphomas and other blood cancers. And the consequence of that was we always knew that we wanted to develop those antibodies for use in treatment. But we also knew that to do so was an expensive endeavor. These parents decided to get together and create the charity Leukaemia Busters, which incidentally takes its name from Simon, our son, who died in 1990. He devised the name and the logo for the charity all those years ago, and we still use it today, so it's something which we are extremely proud of. I'm sure he would be absolutely delighted. He always said himself, having been through the experiences he'd been through, and he had some pretty tough times during his treatment, that he was adamant that he wanted to go into medicine, and specifically into children's oncology. He wanted to be a pediatric oncologist because he recognized that those people who treated him were so kind and so gentle that that's what he wanted to do. I've no doubt in my mind whatsoever he would be highly delighted.